So let's discuss cyclosporine. Cyclosporine is an immunosuppressant drug. We will discuss cyclosporine under three headings. That is, its mechanism of action, uses, mechanism of action. That is first uses and side effects. So first, let's discuss its mechanism of action. So imagine this is a T cell. So if this is a T cell, and imagine this is cyclosporine. So, and this red color triangle is cyclosporine. So cyclosporine enters the T cell. So the cyclosporine will enter the T cell. Inside the T cell, cyclosporine will bind to an intracellular protein called cyclophilin. So inside the T cell, cyclosporine will bind to an intracellular protein called cyclophilin. This cyclosporine and cyclophilin complex, binds to and inhibit calcineurin. What is calcineurin? Calcineurin is a calcium calmodulin dependent phosphatase. So it's basically a phosphatase. This will prevent the dephosphorylation of NFAT, that is nuclear factor of activated T cell. This will not be able to dephosphorylate it because the calcineurin is inhibited by the cyclophilin and cyclosporine complex. So NFAT remains phosphorylated and cannot translocate into nucleus. Failure of transcription of interleukin 2 and other cytokines like interleukin 3, 4, interferon gamma. The transcription will be failure. There will be no transcription of these cytokines. There will be decreased T cell activation and proliferation. Proliferation and activation will be decreased. So this is the mechanism of action of cyclosporine. In this mechanism of action, this NFAT is important. You have to remember, nuclear factor of activated T cells, and calcineurin is also important. This is why cyclosporine is known as calcineurin inhibitor. Now the uses: immunosuppressant drugs will be used in case of which disease? In which cases these drugs will be used? A very common sense, like organ transplantation. So it is the primary drug used for prophylaxis and treatment of rejection in kidney, liver, heart, other organ transplantations. Then bone marrow transplantation to prevent graft versus host disease. Another common sense is that immunosuppressive drugs can be used in autoimmune diseases like RA, rheumatoid arthritis, psoriasis, uveitis, inflammatory bowel disease, IBD, uveitis, severe psoriasis. So these are some other uses. So the uses are renal transplant, liver transplant, heart transplant, or any other organ transplant, solid organ transplant, then bone marrow transplantation to prevent graft versus host disease, then other autoimmune disorders. These are all autoimmune disorders. Now let's discuss about the side effects. So the side effects are very important. There's a mnemonic, that is NGT 6H. This is a mnemonic. So N stands for nephrotoxicity, G stands for gum hyperplasia, T stands for tremors and seizures, and 6 H's. 1, 2, 3, 4, 5, 6. First, HTN, that is hypertension. Then just write down 3 times hyper. First hyper is hyperkalemia. Second hyperuricemia. Third hyper is hyperglycemia. Fifth H is hirsutism. And last is hepatotoxin. So it is both nephro and hepatotoxin. So these are the side effects. So the mnemonic is NGP68. NGP68. This side effects are very important. They acts as short note. So we learned about the mechanism of action and the uses and the side effects.